When working with large carnivores, many times we do have to anesthetize them in order to safely work with them for even such simple things as drawing blood or performing a physical exam. So it's very important that we have reliable and consistent anesthesia available for these animals. But sometimes it doesn't quite work out that way. Occasionally you'll have instances where drug delivery is incomplete. Drug that was supposed to go intramuscularly goes subcutaneously, and the absorption's a little bit slower, so you have an animal that doesn't go down quite like you expect it to. The other thing that occasionally happens is you can have animals that will come up abruptly in the middle of an anesthetic protocol, which is annoying and scary enough when it's a dog or a horse, but when it's a lion or a polar bear, it's quite a different story. One instance I can think of in particular was a polar bear that we were working on, and this polar bear required a surgical procedure, so I had a surgical team actually come in to help us, and these folks were pretty green when it comes to working in zoos, so they're a little nervous to be working on the polar bear as well. And long story short, the polar bear more or less sat up on the surgical table while we were working on it, and luckily we were able to respond quickly and get it back under control. But I've never seen people scatter so quickly in my life. Luckily a few key staff who knew what they were doing and what their responsibilities were stayed in place and helped me get the animal under control. But it's all part of being a zoological veterinarian, is being able to respond quickly and safely to instances like that.